the American Sign Language, and a Spanish interpreter recording a Spanish version of this. We feel it's very important to continue to spread this word to every part of the community that we have. And again, with us today, we are thankful to have Hector Sabito, who is the representative for District 2 of our City Council, and he's going to do the invitation to those Spanish speakers watching right now. About the 4:30 this afternoon, we'll have a Spanish version of this available. Hector, can you do that?
Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a comprender lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español durante esta conferencia de prensa. La grabación completa en español reemplazará la grabación en inglés. En el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de la tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you so much.
Thank you very much for always bringing that to us. Join us today again virtually our Waco Mayor Kyle Deaver, and McLennan County Judge Scott Felton, and Dr. Jackson Gridge, who's the CEO of the Family Health Center and Vice President of the Health District Board. We're glad to have you all here again. Thank you for giving your time and continued effort in all this. I'm going to outline real quickly again what we're going to do as far as our press conference today. I'm going to ask each of you to make an individual opening comment. That's whatever's on your heart and what you feel like is necessary for the community here. And then I will go into the questions that we've collected throughout the community and from media. We'll go through those, and then following that, then we'll let the media, we have 4 media representatives who have called in. They're waiting patiently on the phone, and the mayor will open that up for questions from there. So I'd like to start off with focusing today as a press conference maybe on some things that have been happening the last couple of weeks. You know, the governor issued a new order, the 25% capacity order back on April 27th, and then yesterday he entered some more changes to that. So I'd like for each of you maybe to, in your opening comments to talk about what you think will or maybe could be going on following those orders, and we'll start with our Mayor Kyle Deaver.
Well, good afternoon, and thank you for joining us. I would like to talk a little bit about some of the things the governor covered in his press conference yesterday. He announced that he is opening hair salons and several other businesses at limited capacity. And while I'm glad to see some of these businesses being able to open and get back to work, and I certainly am glad to be able to get a haircut, I am concerned about continuing to open these new segments of the economy without taking the 14 days waiting period that he discussed in his earlier press conference as being a necessary measure. And so I think we're going to have to continue to be very careful as we open these businesses, and I know that they will be responsible and follow the guidelines that the Department of State Health Services has put out for opening, and those are available on that website, although I haven't seen anything yet for salons. The other thing I wanted to talk about is the two things that the governor said he is primarily focused on from a public health standpoint. One being hospital, ICU, and ventilator capacity, to be sure that we continue to maintain that capacity as the economy opens up and we start to experience more cases. We are certainly in good shape for that in McLennan County right now. And then the second thing that he discussed is what he is calling the positivity rate. And if I could ask you to put the first slide up on that. What this is total tests, total positive test results as a numerator over total test results received as a denominator. And this first slide is a daily slide, and it's a little bit hard to read because there are spikes back and forth. There's not much testing being done on Sundays. And there are a number of problems with looking at it on a daily basis by itself. So if you'll go to the next slide, please. The next slide shows a 7-day rolling average. And what you can see here is the yellow line is this positive percentage. And you can see that we are giving more tests on an average basis as we go forward. That's represented by the blue bars. The red bars are positive cases, which are such a small number of those that you can barely see it. But the yellow line is the key here, and that is at one point we were up as high as about a 9.5–10% positivity rate on the rolling average, and now we're down below 1%. So that's great. We're in better shape in Waco and McLennan County than most places in the state to begin doing this reopening. But the takeaway from this should not be that we can relax. We've got to keep that number small, and the way to do that is as we reopen these businesses to follow the guidelines, and for the public, it's to stay home except when you go out to visit essential businesses, reopen businesses, or do things like exercise. We must continue to be extremely vigilant about our physical distancing from anyone who's not in your household, and about the use of face coverings in public, especially in crowded businesses, and regular hand washing or sanitizing. If we can continue to do those things, we can continue to keep this number low, and we have a good chance of success. I'll turn it over to Judge Felton. Thank you.
Thank you, Mayor. Yes, those numbers do look good. And the governor is watching our numbers as well, which is one of the reasons, looking at counties like ours and many others, that we've had great success in addressing how we're going to act day to day in this new environment that we're in. The governor relaxing these orders is really a reward back, is the way I think he sees it for the communities. And from the conversations and calls that I've had, I think there is a great deal of relief seeing that we are opening up this economy and being able to do things a little bit more on a normal basis. One good reason to keep this infection rate on slow increase is so we can allow the professionals to be able to test and create new treatments that are out there. There's a lot of them being approved at this time or getting close to approval. Some are approved and others are in test phase, and then that helps us deal with this infection if it rises again, and be able to have better outcomes for those people that are infected, and keep the death rate low, and plus the damage that this virus would do on individuals' bodies. And then, of course, hopefully in the near future, but maybe before this calendar year is out, a vaccine can be brought forward that works. And so that's the main reason to slow this down. This last order has created a lot of questions on how we're going to be able to operate as an individual business, different types of businesses. There's a lot of websites out there that can give you more specific instructions. We will try to keep our website updated with frequently asked questions and help our citizens in this county be able to utilize this hopefully a permanent reprieve from these restrictions we've been in and operate safely. So I look forward to any questions may come my way.
Dr. Grigg.
Thank you.
Thank you, Judge and Mayor. I'll go over case counts and then discuss our condition currently in the county. Worldwide, there's over 3.5 million confirmed cases and over 250,000 deaths. In the United States, 1.2 million confirmed cases and 71,000 deaths to date. The Texas Department of State Health Services reports 33,000 confirmed cases in Texas, with 906 deaths in the state. And in McLennan County, as the update for this afternoon is a total of 92 confirmed cases to date, 7 of which are currently active right now. We only have 1 person currently hospitalized, but that individual is in critical condition. 81 people have recovered, and currently the health district is monitoring 75 individuals. There have been 4 deaths to date, so no new deaths to report. The total tests performed as of yesterday, 3,332 in McLennan County. We still, thankfully, have no cases in nursing homes, no new confirmed cases with first responders, only 2 total to date, and no cases in the jail.
Okay, very good.
Thank you.
That report today is very good when we have another day with 0 new cases. That's something to celebrate, but be guardedly cautious. Let's start the questions. These are questions that have come through the community, and I've developed a few of them, and the media have brought some of them. Right off the bat, with hair salons set to reopen on Friday, what safety measures will those businesses have to follow?
I'll try to address that one. There's some guidelines that's published by the Texas Department of State Health Services, as well as other websites as well, that gives good recommendations on how salons should open. But, just let me just hit the high points. Basically, it's suggested that appointments are made, that they can control the rate of clients coming into their business. They can provide the proper social distancing and between different clients. They recommend that the clients wear face coverings when they come in. The owners would clean all surfaces before and after a client comes in the business. There's enough time, space between appointments that people are allowed to move in and out of the business without being too close to each other. Also, another recommendation was that those individuals wait in the car until they're called in. So it's a control factor regarding how they bring folks in and out of there. And then surface cleaning is very important in that process as well.
Okay, following up kind of on that, how will the city and the county both enforce safety measures for those and other kind of businesses?
Well, I'll start with that, and then Judge may have a follow-up. If our police officers or our code enforcement officers see a violation, they're going to be talking to that business about that violation and trying to get it corrected. We primarily rely on compliance, to be honest, in this enforcement, and there's a number on our website, on the COVID Waco website, that you can call if you see a business that is operating outside of the rules. These rules are not meant to be punitive. These rules are meant for our public safety. And we have to ask our citizens to be the eyes and ears of the city and the county. If you see something, please let us know. I want to say that largely our businesses have been really great about complying with these things. And we're trying to address this more from an education standpoint rather than being punitive. But if we have businesses or others that are flouting the rules that are in place for our safety, we will act. Judge, do you have anything to add to that?
No, I think that pretty well covers it.
Okay, thank you.
Okay. Is there any new information about the threat posed by asymptomatic carriers?
That's a hard one to say.
I've said it so well so many times.
Yes, that the asymptomatic carriers, or the silent spreaders, as I've seen them described as, are it's a very important, I think, fact to reiterate, and I'd like to wave a flag and jump up and down and shout from the rooftops once again that this accounts for the majority of spread of the novel coronavirus. So we don't have a lot of people in our community who have fever and chills and dry cough and shortness of breath who are going into restaurants and stores who are spreading this virus. The virus is getting spread by people who feel great. And I think that's what's so insidious about and dangerous about this virus. It's that people who don't know that they're infected are interacting with others and spreading the virus in the community. And particularly as we begin to open the economy back up, this will be more and more of a risk. What we can do about it, you've heard the mayor describe this, the judge describe it, I've described it before. There's not any new strategy. It's just that we all have to be committed to this strategy for the long haul, and that is to maintain physical distancing that's 6 feet apart from anyone who's not a household member. And when you go out, to wear a mask. Again, masking is not for your sake, it's for your community's sake. It's because you may be one of those asymptomatic spreaders. So wearing a mask is a way to love your community, to love your neighbor, to protect those who are vulnerable. And then hand washing and hand sanitizing, and then only going out when you really absolutely must.
All right. Pretty much everything we've been talking about, and continuing on and recognizing there are potential spreaders that we don't know who they are. It could be anybody. Is there any more guidance from the governor on when daycares might reopen?
Yeah, I'll take that. Daycares have always been allowed to open, but they've had some pretty tight restrictions on the number of children that can be with any caregiver, and I think some of the daycares have decided that they will not open under those circumstances, that they can't be profitable that way. And so I don't know of any upcoming change, haven't heard anything from the governor about regarding any change in those restrictions on daycares.
Okay. How many of those who have been tested positive are from the group that have been monitored through contact tracing?
Dr. Griggs, would you take that?
Absolutely. Public health monitoring of contacts of those who are confirmed cases has led to the discovery of 12 new cases to date. So 12 of those 92 cases that have been discovered since March are cases that were discovered through the health district's diligent contact tracing and monitoring.
Okay. I think a lot of people are confused about whether or not we're still under the stay-at-home order or shelter-in-place order. Can you explain where we are, and maybe in the state, the county, and the city order at this time?
Judge, would you mind starting with that?
Yes. Well, I know one thing that make it confusing is the increase in the amount of essential activities that are now allowed. So there's quite a few things that one can do, but it's still recommended that besides those activities, it's better to try to stay out of where there's a lot of people around and those things. I think especially for those folks that are 65 and older or have some kind of compromised health situation where they need to take an extra amount of precautions in not being exposed to those that could spread the virus. So that includes your family members. So knowing how the rest of your family that may come visit you have been involved in the community, and whether that brings you more exposure if you're in that range. So the shelter-in-place order was not canceled, but just the amount of essential activities is expanded.
Okay.
Yeah, I agree with that. That's the way I view it too. I mean, the governor's order says that you should avoid social interaction. Our orders say you should stay at home except to do these things. And other than that, the first two qualifiers, it's the same thing. It's essential businesses, reopen businesses, essential activities, including exercise. But all of those things, still including the 6 foot physical distancing and face covering advisories and those things.
Okay, the order the governor issued on April 27th, and for whatever the additional things he mentioned yesterday, he's pretty much been the topic of most questions and conversations we've had, been receiving and everything. And now that the governor has announced additional changes yesterday, things continue to change. And based on his order, what flexibility does the city and the county have, especially when we control the city facilities like the library and the parks? And maybe follow up on that, where and should we be more or less restrictive?
Okay, Judge, would you like to start from the county standpoint?
Well, of course, we do not have but one county park, and it's outdoor. It's more for boating, access to Trading House Lake. But other than that, we have county facilities, and we of course allowing taxpayers access to those things. But we're very cautious about the fact that that we need to bring them in and out of there safely, and so we're doing that. Whether it gets more restrictive or less restrictive is really kind of up to us and the numbers that we drive. So, I would say I'm always open to suggestions, but really everything needs to be pretty much data driven going forward.
Judge, I completely agree with that. I mean, we are looking at the numbers every day, and we've got a lot of facilities in the city, from parks to libraries to the convention center, and we are opening those as we feel it is safe to do so, in compliance with the governor's order and with public health considerations. So we have not opened our libraries yet. We're continuing to do curbside book delivery. That seems to be working well so far. We did make the decision yesterday to cancel the 4th of July fireworks and our Brazos Night concert series, which we all hate having to do, but we've got to make decisions now because of contract considerations that we can't wait until close to the 4th of July to decide whether we're going to have fireworks. And so we can't see at this point that it looks like it would be safe to do that. So we have canceled those events. That's just an example of a lot of hard decisions that our city staff are having to make in conjunction with the council, and we'll continue to monitor it on a weekly basis.
This question is probably a little more globally. Bill, as businesses begin to reopen, Texas cases of COVID-19 have continued to increase. Over the weekend, Texas health officials reported the largest increase in cases over a 2-day period since the pandemic began, adding over 2,000 confirmed new cases. Why is now the right time to reopen businesses, and what steps are able to take by McLennan County to mitigate damage in the case that we have a sudden eruption of cases, as we've seen in the cities like Abilene?
Well, I'll answer that a little bit, and then give Dr. Griggs a chance to weigh in, and of course, Judge Felton, if you have comments, always welcome. I think that there is some question about whether the state is in good shape to begin to reopen. The cases do continue to climb, but as Governor Abbott pointed out yesterday, the positivity rate, as he calls it, has been declining for the state, and that is the number of confirmed positive tests over tests given. So that is a good metric for the state. In Waco and McLennan County, I think we are ready to take these steps that are limited steps, but we need to take them and then wait for 14 days before we take the next steps. And I hope the governor will do that going forward. Dr. Griggs, do you have comments on that?
I agree that we are among communities in the state. We are in a unique situation right now, having a low prevalence. That puts us at great advantage. But we could lose that, all the work that we've done, all of the gains that we have compared with other communities our size. We could lose that very quickly if we were to become lax on the health behaviors that we've been describing. It won't take long for us to catch up with other communities because of the exponential growth of the virus. If we throw caution to the wind, or if we misinterpret the governor as to be saying, don't worry anymore about this pandemic. We have to be very, very careful going forward if we're going to continue to keep our community safe.
On that subject, is there specific data that the medical teams are watching, and what are the specific benchmarks that are being monitored to ensure public safety?
Dr. Griggs?
On a daily basis, we are meeting to review, and we being the city leadership, the county leadership, the mayor, the judge, the healthcare executives, myself, the leadership from the health district, Dr. Gray, we're meeting to review the number of tests that have been performed, the number of positive tests, hospital capacity, ventilator and ICU capacity, and the monitoring, contact tracing that's being performed by the health district. And we're interpreting what this data means from the standpoint of public safety. Absolute numbers are important, as are ratios like the positivity rate, but there is a lag time in terms of how we change our individual and community behaviors and the impact that makes, as is measured by new hospitalizations, deaths, new cases. And that lag time of 2 to 3 weeks makes it really important that we're also watching rates of rise. And even when there are small upticks in numbers of cases or hospitalizations, that we sort of sound the alarm bells and take what measures we can take in order to try to quell the wave of infection. So we're watching those carefully, we will certainly bring that all of that information, if it becomes alarming, to the attention of the public in all the usual channels.
Well, I agree. And, we've been so fortunate here in McLennan County to have as few deaths as we've had. Very few people in ICU, with people just struggling for their lives. And hearing the reports of people across the state and the nation who friends and family, they're fighting for their lives. But, we've been so blessed by that. I'm worried that, and we've had comments that people, by doing this, kind of opening the gates, so to speak, that without a careful balance of what's going on with trying to get our economy open and maintaining the health and well-being of our, is there a fear that we should have in McLennan County about doing it too quick and too far? All these things that are balancing?
It's a good question, and fear is a funny thing. If there's a rattlesnake in the high grass, fear will save you from getting bit. But fear that is that's constant, everyday fear can be equally destructive. So I might think about having a very healthy respect for the lethal nature of this virus, particularly among those who are health vulnerable. So again, these health behaviors are to protect our mothers and our fathers and our grandmothers and our brother who is obese and our aunt who is on medicine for blood pressure. We're taking these behaviors, we're making these changes in our life to protect that population. And if we forget that that's why we are wearing masks, if we get to that disposition where, well, I'm a tough guy, I don't need a mask, or putting on a mask isn't cool, then we're putting those who are health vulnerable at risk, and it shows a disrespect for the lethal nature of this virus. And I might also use this question to address another thing that I've seen over the last couple of weeks that has really begun to concern me, and that is the politicalization of our health behaviors. It is really agonizing to watch, because during a time when our country is already so politically polarized, if we start thinking of health behaviors in political terms, we are doomed as a community. This virus doesn't care how you vote, and our health behaviors and how we think about this virus should be only informed by our science and our love for each other. So I think that economic easing of restrictions made sense, but our governor was clear that this wasn't a suggestion to return to life as usual. So we really must heed that.
Okay. So far we've been really fortunate in McLennan County to not have anyone in nursing homes, as you mentioned, Dr. Griggs, early on, or retirement centers. We've heard the situations where through other parts of the community in the country, it's been devastating once it gets started. Speak to what we need to do to continue to avoid exposure to cluster groups, not only in confined nursing homes, but it's coming up. Family reunions and things happen in the summer, and clusters of groups might begin. Talk about that.
Dr. Griggs.
By prohibiting visitors, nursing homes can avoid a great deal of that viral traffic. But at the same time, those who work at nursing homes have to be very careful to protect themselves from exposure, understanding that if they become the unknowing carrier of the virus, they can introduce that virus into a community of vulnerable people. So staff hygiene, both while at work and out at home outside of work, is really critical. And honestly, the same is true for manufacturing and for all employers who have multiple staff or customers indoors. And I would again refer them to the Department of State Health Services guidance that's available online. And one additional comment, and this is in particular for employers of, I think that this pertains mostly to employers of lower wage staff and employees. If employers penalize their employees, or if employees feel like their job is at risk for missing work due to illness, then employees will come to work ill and spread the coronavirus. So I think it's imperative that our employers emphasize that ill employees, even those with milder symptoms, take off and try to get tested. And I think from an economic standpoint, this challenges employers, but it's a much better strategy in the long haul. If an employee comes to work with coronavirus and spreads it to other employees, then suddenly you don't have a workforce, and you've contributed to community economic damage.
Dr. Griggs, thank you for that. That's a really important point that I'm not sure we've made before. And as far as family reunions, I mean, I think the reality of that is it would be best to do those by Zoom or by WebEx, because particularly when you have families that are going to be traveling from different locations and getting together, this is not the time for that. And I'd like to say that it'll be over by July or August, but I don't think that's the case. And I just think we would be better off, for the sake of your family, to not have that family reunion this year in person.
Okay. As we move increasing numbers of persons into like restaurants and other buildings, what concerns should everyone have about how much more contagious COVID-19 is than the common flu? Because just as you indicated earlier, so many people say, well, I'll just tough it out. Yeah, it's just like the flu, And so there's new concerns that we need to think about as we're going into these restaurants and buildings.
Dr. Griggs, would you take that?
Yeah, absolutely. And I'm going to sound like a broken record just because this is the same information. When we go into businesses, whether it's a restaurant or a clothing store, if we see that employees there or other patrons there are not abiding by social distancing, if it's a threat to our own individual health or community health, we need to get out of that environment. We need to not be customers of those kinds of places right now. If we vote with our feet, it will be a self-corrective to those businesses so that they will kind of get their practices in line to protect the community. The coronavirus is indeed more contagious than the flu. We've talked before about the basic reproductive number, which is how many people does an infected person spread the virus to. The flu, the average is about 1.3. So if someone has the flu, on average, they spread that virus to 1.3 others. But remember, with the novel coronavirus, the range is 2.2 to 5.7, so much, much more contagious. Than the flu. We've talked before about the basic reproductive number, which is how many people does an infected person spread the virus to. The flu, the average is about 1.3. So if someone has the flu, on average, they spread that virus to 1.3 others. But remember, with the novel coronavirus, the range is 2.2 to 5.7, so much, much more contagious.
Would you have anything else to say about that?
Well, I think you pretty much covered it. I know if I went into a restaurant, not as a county judge, but just as an individual, and someone was waiting on me during this time of the COVID-19 situation going on, that I would feel way more comfortable. In fact, would not be comfortable if they did not have a mask on through this period. I don't know where that individual's been. I don't know, where they go after work. So why not them go to a little effort to protect me if I'm going to be the one that's paying the bill?
Thank you, Judge.
With several days in a row now, 3 last time, and we just skipped one yesterday, and had another 0 case in McLennan County. Now, what do you want to tell our community regarding a possible new wave of virus, and how we're prepared for it or should be prepared for it?
Judge Felton, would you take that?
I'm sorry, I missed the question. I was thinking about something else.
That's okay.
I completely understand.
I probably confused you by saying it.
I'll try to answer it.
Go ahead.
I hope people watching this are more excited than I am. But go ahead.
I love it.
I think it's the same thing. I mean, we know that we've got to continue to use these precautions, or a new wave will come. It's not whether it will come; it will come because of the asymptomatic spread. The fact that most of the people that are walking around don't know that they have it is the thing that makes this disease so confounding, so hard to deal with. But the way that we beat it is that we maintain our social distance, we wear face coverings, and we wash our hands, and we stay home as much as we can. And with that, we have a pretty good chance of avoiding another wave. If we don't do that, it will come.
And that's what I would have said if I'd heard the question.
Well, I'll try to speak up and be more clear in what I say. We obviously keep getting questions on strange things that we thought we've answered before, but that's okay. That's why we're repeating them. We keep getting questions about going to the doctor. When can I go to the doctor again? You want to address that one?
Dr. Griggs, will you take that?
Sure, absolutely. Well, all of the primary care clinicians in our community at all the systems have described ways in which they have worked to protect their patients and create safe environments. And that, of course, is the same here at the Family Health Center, where we've worked hard on protocols to ensure that each person receives safe care and the right environment. I think all of us are hoping that our patients will call first before they come when it's a non-urgent visit, so that we can give them a little coaching or explain a little bit about how the new system is working. But if you do show up and don't call before you come, we will take care of you and make sure that you are seen in an environment that optimizes each individual's safety. You know, one of the things that has concerned us is that, you know, as soon as we saw this initial wave of disease that was hitting our country, we called all of our patients who didn't need to come in immediately, and we postponed their health care. And this is health care for diabetes and emphysema and asthma and heart failure and cirrhosis and all of the other ailments that chronic disease that people seek care for on a regular basis. We said don't come in for the immediate time being unless it's emergency. And then we worked really hard to build systems to where we could accommodate care for everyone who needs care in environments that were safe. And so we're at that place now. We're eager to see patients now. If you are someone who on the balance we think can be managed via a telephone call or telemedicine, we may tell you that we prefer to do it that way and see what you think. If you're somebody who needs a physical exam, needs a face-to-face visit, we'll take care of you certainly in that kind of environment as well. So we have all those systems now built and are ready to see it here. And my colleagues at the other systems are in the same place.
We've talked so many times about how well our citizens have performed in responding to the requests and calls to social distance and do all the good things we've been doing. What can those same people do to get our economy going? They have been motivated to take care of the COVID part of it. Let's talk about the economy. What can they do?
Judge Felton, will you take that?
Well, the thing that they can do, and I know they will do, is the business people in our community are salespeople. And they're going to sell their patrons and customers on the fact that they can come into their business, their institution, their restaurants, or jewelry stores, and they're going to be safe. They're going to be, when they go in there, they're going to feel safe. They're going to feel comfortable. It's going to be like it used to be to a certain extent, and I think they'll end up opening that pocketbook and spending that money. One thing I would like to add, I'm a big proponent of local control. And I think as long as we take control as individuals and we look like we're in control as a community, we will make our own decisions. If we don't do it and our numbers are bad and the confidence is lost in the community, we'll lose control. There'll be the governor, there'll be some other institution that comes in and tells us what to do. And so I think it's an opportunity for us to show.
Okay, I'm going to wrap up pretty quick here so we can get to the phone calls in a little bit. Mayor, we constantly get things wanting to know when different things are opening. When's the municipal court going to open? What about garage sales and a couple of those things? Can you maybe address those?
Yeah, the municipal court is going to open on May 18th. That's when they will open their doors and you can go and deal with the clerk there at the municipal court. Judge Taylor at this point is planning to have his first in-person hearings on June 6th. All of that is, of course, subject to change if the numbers started to trend differently. But for now, those are the dates. On garage sales, inside the city, you have to get a garage sale permit to have a garage sale. Garage sales are not a good idea right now. and we are not issuing permits for garage sales in the city of Waco. I can't tell you when that will open up. I would say not in the next few weeks anyway.
Okay, staying with the economy a little bit, the temporary business grant program that was funded by the city and the county through CDBG and the economic development funds has received a huge number of applications, far more than the funds will cover. Even though this is an unprecedented move by both the city and the county, is there a chance that more funds would be allocated to meet the needs that are being requested?
You know, I don't know about that yet. We are processing those requests now, and it may be that the requests that we have, by the time they are checked and reviewed for being complete and being qualified for those funds, will not exceed the amount of funds that we have. And so, if they do exceed that amount, then perhaps we will have some additional CARES money or something that we might be able to stand up a little bit more money for that fund. But we don't have plans to do that right now at the city. Judge, do you have any comment on that?
No, that's a position we're in.
Okay, very good.
Mayor, I think we're ready to take calls from the media if you'd like to run that for us.
Okay, I'll be glad to do that. The first caller will be Shaquille Omari from Fox 44, and Sam Cedar at KWBU will be next. So, Shaquille, do you have a question?
Shaquille, are you on the phone? You may have dropped off.
All right, let's try Sam Cedar at KWBU. Sam, are you there?
Yeah, can you guys hear me?
Yes.
Yes.
All right. Yeah, I'm just wondering about a couple times over the course of this presser, Dr. Griggs stressed the importance of going out only when you absolutely must. But at the same time, people are being encouraged to do things like go to hair salons and dine in at restaurants, which don't exactly seem like things that anyone absolutely must do. So I guess I'm just wondering, how should the public be expected to reconcile messages that seem to be kind of conflicting?
I'll try to answer that. I think that is one of the big problems that we've got, is that we are trying to balance staying as safe as we reasonably can from the COVID-19 pandemic with economic damage to our community and to each of our small business owners. And so that's the reopening that the governor has done, is opening the spigot a little bit and allowing people to go out and do those things. But not just have a free-for-all, having parties, getting together with friends, and failing to follow the social distancing guidelines. So it is sort of a tight wire that we are walking, and it is hard to, it's hard to communicate clearly on that. But I think the main thing, the biggest thing, is to maintain that physical distance from people who are not in your household, and wash hands and wear face coverings whenever you can.
And I might also, Mayor, if I might, just jump in also. And Sam, it's a great question. I think it reflects somewhat of a moving target for all of us as we learn more about this disease and how it's impacting different communities. We're modulating our message a little bit. Right at first it was, lock yourself up, avoid, we don't know, this thing looks like it's going to hit us hard, and it's going to threaten our hospitals, etc. And now we're seeing, we've done a good job. We can open up a little bit, and we feel safe opening up a little bit. We'll continue to monitor, but I also would say don't be surprised if 6 weeks from now, if we're messaging something that feels different than what we're messaging today. I think the important thing is that we're all in communication, because if we do see exponential growth of this virus in our community, then we might go back to recommendations that people really isolate themselves for a while.
Thank you, Dr. Griggs. That's a good explanation. Drake Lawson at KWTX, and then Jasmine Caldwell at KCN would be next. Drake, do you have a question?
Yes, Mayor, I do. Can you all hear me okay?
Yes.
We can, thanks.
Yes, go ahead.
Okay, yeah, sorry. I just wanted to ask real quick about sales tax. I know the last couple of weeks the business is being shuttered. That's obviously taken a hit. Is there a plan to try to make that money back? What happens with the sales tax that has been lost? And we can assume we'll probably still have some hurt moving forward.
Yeah, Judge Felton, would you like to start with that?
Well, if you ask what happened to the sales tax we didn't collect, I think it went off in a green fog. We're not going to get any of it. So we can only hope that that our retailers here in our community can get back to the levels that they were at in their sales prior to the COVID-19 situation. And but it's not going to be. We're not going to have the year in sales tax revenue that we've had in the last several recent years. So we can just look to the future.
Yeah, and I'll say for the city, the sales tax makes up a lot of our revenue, but we always budget very conservatively for sales tax because that's just, you never know what's going to happen from year to year with sales tax. So it will be a hit to our budget. We will have to make some cuts that correlate with that hit, and we're working through those budget cuts right now. Jasmine at KCEN.
Yes, this question is for the mayor. At the beginning of the press conference, you had threw up a graphic with the trending COVID-19 numbers, and I was just wondering, are you guys able to provide those numbers on your COVID-19 Waco website? Are we able to get access to that graphic?
Yes, we should have those graphics up on the website very soon. You know, those numbers will obviously change, and there are always 2 or 3 days there at the very end that we're waiting for results from some of our testing. Some of our testing we get very quickly, and some of it goes to labs that may take 2 or 3 days to get the results back to us. But yes, we will get that on the covidwaco.com website, and I recommend that everybody go there to get the latest information. Thank you, Jasmine. We'll take one more question from each of you. Did Shaquille ever check back in from KWKT?
Shaquille, did you ever show up on the phone?
Okay. Let's go to Sam Cedar at KWBU.
I don't have any more questions today. Thank you.
Okay. Thank you, Sam. Drake from KWTX.
Yes, Mayor Deaver, one more question that we had regarding tourism. I know that's really far out, but we're kind of thinking, you know, as we reopen, I know that's the balance of everything, but as we do reopen and we move into fall, tourism has always been a big part of Waco. Is that something you guys are thinking about? What are you anticipating as we move into the summer months and into fall?
Sure. Yes, we're definitely thinking about it. It's a big concern. The tourism economy has clearly taken off in Waco and is now a big part of our economy, and we need to get it back, but we've got to do it in a safe way. And so, you know, I think I know that Magnolia was very careful and closed down the silos, the market, before in fact, they closed all their facilities before they were ordered to do so. But we'll be working with them and trying to figure out how quickly we can get everything reopened and start advertising open for business again. Even as we do that, though, we will have to continue to maintain our physical distancing and other protocols. Jasmine Caldwell, KCN.
Yes, just one more question. So now that the economy is slowly starting to reopen, what would you say to those people who may feel that, you know, maybe the threat of the coronavirus is slowly, you know, being over?
I'm sorry, Jasmine. Could you ask that one more time? I missed the very last part.
Oh, okay. So now that the economy is slowly starting to reopen, what would you say to, you know, those people who may think since the economy is starting to reopen that the threat of the coronavirus is over?
Well, that's one of my biggest concerns. And I think that we're seeing that in some places where people are just acting like this is over and we don't need to worry about it anymore. And I think that's sort of a human tendency. We're tired of this. Our attention span is full of coronavirus, and we're ready to move on. But we can't move on. And if we do that and don't continue to observe these cautions, we are setting ourselves up for another big problem. And that's the last thing that any of us wants. So, Dr. Griggs, would you add anything to that?
Well, you know, the wonderful thing about a pain signal in the human body is that as soon as you touch a hot stove, that signal gets to your brain and you know to move your hand off of that hot stove. Some of the problem, again, with this virus is that lag time. It's that a behavior doesn't trigger as something dangerous or problematic for potentially 2 or 3 weeks. So if I were to put my hand on a stove and it didn't register in my brain for another couple of weeks, I wouldn't have a hand left. And that's my concern about those that might feel like they can throw caution to the wind, just return to life as usual. It really is that it'll be far too late before we can we see the impact, and then there'll be people who have succumbed to this virus that didn't need to. I think respecting the science of epidemiology and doing what we can all do to care for each other right now, based on that science, is what's most important.
Thank you, Dr. Griggs. Rhiannon Segert from Waco Trib is on the line. I didn't know you were here. I'm sorry. I would have called on you earlier. You have a question, Rhiannon?
Yes, all right. Do we have an estimate of how many people in the county are considered at risk because of either their age or some other factor like asthma?
Dr. Griggs, do you know the answer to that? I don't.
I don't have those figures offhand, Rhiannon, but it's a great question. It'd be nice to know that. Both raw numbers and percentages. I imagine that data is available. It might take some sleuthing, though.
Right.
And Rhiannon, I gave everybody else a chance for 2 questions. If you have another question, we'll be glad to answer that.
Yes, I do. It came up at City Council again yesterday. Is there or will there be a set number or percentage or positive rate that would be considered dangerous for the county as things begin to reopen? I know we've talked about if there is, a serious, like if there's a surge or a spike, that would, maybe trigger things shutting down again, but there's still not a number set. Will there be?
Dr. Griggs, do you have an opinion about that?
I don't have a figure that I can just cite you offhand. I'm sorry, Rhiannon. I think that as long right now in the current low prevalence situation that we're in, again, trends, rates of rise are going to be what's most valuable to us. I think in areas of higher prevalence, thresholds become more important. But right now, it's watching those lines carefully and seeing their behavior that will be most informative.
Judge Felton, you have anything to add to that?
No, not really.
Okay. Thank you, Judge. Thank you, Rhiannon, and thank you all for your good questions. I want to say again how important the press has been to getting out good information about the coronavirus and the things that you can do to protect yourself from it. So I appreciate all the work that you all do. And I will turn it back to Larry to introduce closing comments.
Yes, thank you again for all the media, as the mayor mentioned. Would like to invite everybody, all 3 of you, to make closing comments. So starting with Dr. Griggs and Judge Felton, and then wrapping up with the mayor.
Well, there's a population that I want to heartily thank today. Today is National Nurses Day, and so I want to thank all of the nurses at the Family Health Center, the nurses at the hospitals, the nurses at long-term care facilities and in schools and in clinics all over our community, those who visit patients at home, those in schools, those who fill in the gaps everywhere. Your heart of service Your love for the community and for those who are ill is a massive healing force for all of us. There's a nurse by the name of Donna Cardillo who puts it this way. She says, "Nursing is not for everyone. It takes a very strong, intelligent, and compassionate person to take on the ills of the world with passion and purpose and work to maintain the health and well-being of the planet. No wonder we're exhausted at the end of the day. And yes, no wonder you are indeed exhausted at the end of every day. And we are so very, very grateful for spending your energy on behalf of all of us."
Thank you, Dr. Griggs. Judge Felton?
Yes, those very good thoughts, Dr. Griggs, and appreciate the mayor again for all that he's put in the many hours and of hard work in representing the city of Waco and really in the broader community as well. And you've heard the term "be the guy," and using that in a gender neutral way, that we want to be the guy. If you're a business person, be the guy that people are confident when they go in your place of business. It's clean, it's healthy, it's a good atmosphere. Just always talking about the restaurants, it's not just food and service anymore. It's that confidence that you're given that there's good health practices taking place. If you're the individual, well, be the guy that takes care of your own health first, and that'll take care of the health of many others. Also, be the guy that takes care of your family, and your family touches other families, and so having someone that contracts the virus can really cause adverse effects to a lot of folks, and more than likely in your family you're going to have someone that's in that older age group or maybe compromised health condition too. So just be the guy that thinks about all those different things. I look forward to us all having continued success in the county. Thank you.
Thank you, Judge. And thank you to both of you, Dr. Griggs and Judge Felton, for being here again today, this week. I just appreciate it, all the work that both of you are doing in our community. I want to thank our city staff again for putting this press conference together. It's a lot of work, but we think it's important to get the questions that our citizens have answered and try to keep them informed about what's going on in our county and our city.
Yep.
I do want to remind people who have not filled out your census yet to please go to census.gov and fill out your census. It takes less than 10 minutes. It is really important to our community that everybody be counted. We will be having a special meeting tomorrow at 1:30 to pass a new order that will bring our order in compliance with the governor's order regarding hair salons and other things. So we'll be doing that tomorrow. I appreciate Jackson mentioning National Nurses Day today, and I too want to thank the nurses. It is also coincidentally Public Service Recognition Week, which is a week that we are to recognize federal, state, county, and local employees. And a lot of these people don't get mentioned much. We talk about first responders, but we also need to think about all the people that are keeping our lives going, with whether it's garbage pickup or water or sewer or any of the number of things that our cities do, and our counties and our state and federal government. So thanks to all of them. Regarding first responders, though, we had an incident that happened almost 2 weeks ago now, where we had a serious fatal accident on I-35 that, and I didn't say, hey Siri, it's a serious fatal accident on I-35 that exposed a number of our first responders to coronavirus. One of the persons that was in one of the vehicles tested positive for coronavirus. Now, we've had 11 of our police and firefighters quarantined for 14 days, away from their families, away from everyone, while they wait to see whether they may have the coronavirus. That's just an example of the selfless nature of these public servants. And, it just demonstrates how difficult their jobs are on a regular basis, and then you put the COVID-19 virus on top of it, and it's just really dangerous for them. And so we appreciate them so much. So I ask for your continued prayers for healthcare workers, first responders, essential workers, and their families who are also stressed by this. I want to encourage people to buy local whenever you can. As our businesses are starting to reopen, please try to purchase from them the things that you need if you can. I want to continue to thank the citizens of Waco and McLennan County for the great job that you've done, and the reason that our numbers are as good as they are. We've got to continue to do it. Even though we are now in a deliberate reopening period, social interactions outside your household still should be the exception rather than the rule. People can participate in essential and reopened businesses and health activities, but you should continue to refrain from activities such as parties, book clubs, other clubs, and group meetings, and non-essential social gatherings at this point. When you do go to those things, when you go out into public, please continue to use your physical distancing and other measures. Take care of yourselves and take care of one another. Thank you. Have a good day.
Before we leave, I would like to point out there are a couple of things that are events are coming up here that really need to be publicized. Thursday afternoon or Thursday evening at 6 p.m., there will be a virtual town hall put on by the Family Health Center. And that will be happening at 6 o'clock. People interested in asking questions to the medical community can email townhall@wacotx.gov. That's just simply townhall@wacotx.gov. And live, Dr. Griggs, I'm sure you'll be involved, Dr. Newman, some other people that we're hosting that through the city with Council Member Sabito and Bearfield being involved greatly, and that's one of the other options. I've also found that the Texas National Guard will be doing some drive-by testing on Friday for a limited amount of time. They'll be at the Belmead Fire Department. Is it fire department?
No, it's Belmead Civic Center.
Belmead what?
Belmead Civic Center.
Belmead Civic Center, excuse me. Belmead Civic Center Friday morning, and at the number 5 fire station on Bagby right off of New Road. There are some testing criteria that I'm sure will have to be screened. The Texas National Guard is coming in. They have a limited amount of tests. So I would say if you feel like you want to be tested, I would think you would have to have some kind of symptoms possibly, but so they're not going to have enough tests for just masses. But those are two events that are coming into our community that are going to help pursue that. Again, I want to thank all three of you all for being here every time, working so diligently and giving of your time and energy. I know this is your job to a certain extent, even though you don't get paid for it, Mayor. But we appreciate so much the dedication of all of you all in the work. And that concludes our press conference. I encourage everybody to go out and enjoy a beautiful afternoon.
Who was always at night shaky.